Hello, I'm Kimra Major Morris, and welcome to Legal Connections. COVID-19 has affected our daily lives, from social distancing to constant hand washing to testing to homeschooling if you have little ones. But this illness is affecting greatly communities of color. And here to talk about health disparities in the wake of COVID-19 is visiting law professor Shelley Page. Thank you for joining us.
Thank you, Kimra, for having me.
What are health disparities? What do we mean by that?
So when we speak about health disparities, it refers to a higher burden of injury, illness, disability, even mortality that's borne by one group versus another group.
Okay, and tell me about how this is affecting communities of color.
So pre-COVID, we had some issues that were going on in the African American community that clearly was a result of racism and discrimination, as systemic racism that we have in institutions. Healthcare institutions is specifically what we're looking at today. So African Americans suffer disproportionately from certain diseases: high blood pressure, also called hypertension, lung disease, cancers, even lung disease, diabetes. That's the one that escaped my mind for a second. And so as a result of these diseases that we disproportionately suffer from, it weakens our immune system. So when a disease like COVID comes along, our immune system is not as strong. Our immune system is not as strong in fighting that disease. So when we look at some of the things that are in place that have hurt African Americans: lack of quality access, lack of access to quality health care, not having a primary care physician. A disproportionate number of African Americans use the ER as their medicine, as their way of being treated for different kind of illnesses and sicknesses. And so when we look at the legacy in this country of structural, systemic discrimination, it has severely limited access to health and wealth to African Americans. And we see that playing out with COVID-19.
Thank you for sharing just a little bit of background. And also, what we're seeing some stories about people who can't afford to take off from work to go and get tested.
Yes.
We're seeing how people are being treated differently in hospitals who are having near-death experiences and a lack of attention to some of these biases. What is it that we can do?
So there are things that we can do. There are things that are within our control to make this situation better. One of the things that I think of is eating a healthier diet. And this is just for my husband, my family, and I. We actually are plant-based vegans. And so I think even if you eat meat, cutting down on some of the meat that you eat, eating healthier portions of the meat, cutting out processed food, high sugary foods, sodas are horrible for us. Increasing our water intake, making sure that we get plenty of rest, making sure that we get vitamin D. A lot of diseases and illnesses are a result of not getting enough sun. And even managing our stress levels. If you pray, if you do yoga, meditate, some kind of self-care, because stress manifests itself in African Americans in those diseases that I talked about earlier: high blood pressure, hypertension, diabetes, high cholesterol, cancer. Stress manifests itself differently. Even racism. A lot of African Americans, we internalize racism and it materializes in negative health outcomes. So those are some things that we can do for ourselves. There are some other things that we can do, making sure we look at who we're voting for. Today I filled out my vote right here. I voted.
Your ballot, yes.
I filled out my ballot. And so making sure that we are aware of the candidates that are running for various offices, no matter what that office is. What does that candidate stand for? Do they stand for positions that help people in my place, people in my position? Healthcare, economic opportunities, education for all. Depending on what zip code you live in, that depends on the kind of education that your child is going to receive. So if you're voting for people that stand for principles that hurt your position, then it makes no sense to vote for positions that don't help you. So I think making sure that we know who we're voting for. Also, things that are outside of our control, looking at racism and how that affects us, looking at who are our allies in this fight for equality and for justice. One of the things that I have been doing some research on, for wealth, for every $100 a white family has, African Americans have $5.04 in wealth accumulation. And so I encourage young people, if possible, finish high school, go on to college, if possible, go on to graduate school.
That's right.
That doesn't mean, Kimra, that we're not going to experience racism, because, and this is a sad statistic, African Americans with a college diploma, with a college degree, make less than a white person with less than a high school diploma.
Wow.
That's crazy. And so in my head, I'm thinking, okay, so what kind of advice, because I'm naturally optimistic, what kind of advice can I give to a young person? How am I telling them go to college when you're going to make less than a person who didn't even a white person who didn't graduate from high school? My mom and dad were educators, and they raised us believing and understanding that education is the way out. And I still encourage people to go to school, run for elected office, know who your officials are that are running. Again, looking at COVID, making sure that we exercise and eat a healthy diet. Zinc is a good thing that helps our immune system. Yeah, making sure that we eat and improve Google, how do I improve my immune system? Because that's what's hurting us with COVID. COVID is overtaking our immune system. Don't smoke. Don't put tobacco products in your body. It just hurts us. You know, and I don't mean to sound like mom, but
listen, I have two daughters, and, you know, as you were speaking, just going back to what you were saying about lower your stress, you know, and I'm sure there are people listening who will say, well, how can I do that if I'm not working? You know, if I'm afraid to go to work because I might bring something back to, you know, I'm a caregiver to my parents. And so it's just stressful to leave the house and to think about, you know, if it were my fault that they caught something. So, and then of course, you already addressed the economic part of it, you know, and then you look at, you know, things going on around us, you know, George Floyd's murder and all the civil unrest. And so I know that it's difficult, you know, I was thinking, just because I'm pretty sure somebody's going to say it's impossible, but I saw something once or read something that was just talking about how we choose our thoughts. And it's not to say that you're going to pretend that there's nothing wrong in the world, but just for 30 minutes, choose to think about yourself, right? You know, or just to elevate your mood and do something for your body. So
that's right. And I am a faith believer. I believe in God. I believe in Jesus Christ. And there's a Bible verse that actually says that whatever things are lovely, whatever things are just, whatever things have virtue, if there's any good in it, think on that. And that sounds crazy. Okay, but cops are beating the hell out of me right here, but I'm over here quoting a Bible verse. I just have to believe in the power of God and the reason that he gave his word to us. And even if you don't believe in God, meditating, just practice deep breathing, making sure, just going for a walk.
Right.
It will do wonders. Drinking water, eating as close to how the vegetable grew, eating that. Yes. Fresh fruits and vegetables really will do wonders for us. And you know, Kimra, one of the things that I want to also just focus back on, this disease is disproportionately killing us. And it's not just poor Black people, wealthier Black people with money and with health insurance, health coverage, are still dying in disproportionate numbers. So it's not just about money. It's not just about having access to health care. So it's something endemic to us that we have got to do something different. I'm not waiting on a white person to come along to help me and save me. Lord, help me figure out what I can do to help put myself in a better position. And so even today, I hate it. I hate working out, but I get up and I do it. We walk.
I could write the second verse to that song, but okay. But you talked about, I'm so glad that you emphasize what we can do for ourselves, because of course there's this mistrust, on the vaccine. If they come up with a vaccination, many people are saying no, thank you, because of our history. And
Yeah.
so, so talking about the trials that people do, the medical trials that they're doing to come up with the things, and then going back to, even if you had volunteers from our community who might be interested in participating in such a trial, then it goes back to, well, who's going to pay for my time off to participate in this trial?
Yes. Many times the trials will give compensation for the money that you missed from not going to work. But I totally agree with you. There is a clear distrust in the African American community against the medical community, and it's well founded. Looking at Henrietta Lacks, looking at the Tuskegee syphilis experiment, James Marion Sims, the father of gynecology, there's a lot of ground for mistrust. But we still have to find a way to work with the medical community to help us to stay healthy. Because it's not just eating healthy is going to get rid of COVID. While having a healthy immune system will help us fight it, eventually we will need to have some kind of vaccine in place for this, or we will continue to die in these high numbers. And that's not the answer either.
No. Well, thank you. Is there anything else that you would like to share? We're so grateful that you came on to spend some time with us and shed some light on some of these issues.
Yes. I always like to leave on a positive note, and I just really do believe that God is going to see us through this. I know that it has been hard. I have shed many tears over the number of African Americans that are perishing in all of this, Hispanics as well. But I just have to believe that we serve a God who is faithful, and he will not forsake us.
Listen, I wonder how people get through without that hope. So, yeah.
But I wanted to say, God bless you for the work that you do in our community. FAMU is proud of you.
Oh, thank you so much. And I'm proud of FAMU. I'm just really, it was one of the best experiences of my life. And I
praise God.
Myself very fortunate to have had that experience. Yeah. So thank you again for joining us.
Thank you. God bless you. Thank you.
Thank you. Thank you for watching Legal Connections.